Okay, you guys, so in the interest of time, let us be on time and start today for those of us who came here on time. Thank you so much for coming today. I know it means a lot to me that you're spending this evening with me. It's Monday evening and it's around dinner time. So, and it's an important topic that I hope you'll get some insights and benefit into, as well as ask me questions. If you could save the questions for the end, I'd appreciate it. And so especially with the recent fires, detox and toxins become a bigger issue. So we just to check in with people. Hopefully, well, all of us were kind of indirectly or directly impacted by this fire. We've lost lives in LA. We've lost homes, businesses. And the one thing we all have in common, which is the air we breathe, is actually quite toxic. So I know this is a real tragedy for our communities and greater Southern California, but it's important in this time to know your body and know how you can be resilient during this time. Okay, great. I will definitely get into that. Okay. Oops. Great. So, New Year detox. How do you cleanse, revitalize your body and your mind? Oops. So what are toxins? This is the things I'm going to cover today. I know I will try and keep this brief so we have enough time for questions at the end, but I'm going to cover what are toxins, what toxins can do to your body, give you a brief history behind toxins in California, talk about the recent wildfire toxic burden, what determines the toxic effect on your body, what are some of the symptoms you might have if you have toxins or hidden toxins or known toxins, what some of the lifestyle hacks that you can do that I do myself that can really help you detoxify, what supplements you should consider when you are detoxifying or trying to do a detox, and then how you can test for toxins in yourself, and what are the two ways we can help support you. And for those of you who can manage to stay till the end of this, we do have a raffle. I'll be giving out one of my favorite supplements for detox to one lucky winner that Alyssa, who's moderating this, will pick out for us. This is, it's a strange time. In January of 2025, I had one of my colleagues, two of my colleagues actually this week, call me from the West Side. These are specialists, regular conventional medicine doctors calling who live in the Palisades. And one of them just went up today and she said with the rains, she can barely breathe and she feels so much worse. She has headaches and she's like, I don't believe in all this functional medicine stuff you do. But I've asked my regular medicine colleagues and they don't have anything I can do for this. What do you recommend? Can you send me some links as to what I should start taking? So it's unfortunate that regular medicine doesn't have, or conventional medicine doesn't have an approach to this. But the good news is functional medicine has been looking at toxins for such a long time. And for those of you who've been my patients before or our patients before, you know that it's a topic that's dear to every functional medicine MD's heart. Yeah. So what are toxins? A lot of you kind of know this already, but usually they are different kinds of toxins. Some are naturally occurring, like Botox, that is, safe, and if you're using it appropriately. There are mold toxins that are surprisingly common in LA that can affect some of us and not all of us. And remember, toxins don't affect everybody equally. It all depends on your genetics that you came in with that makes you more susceptible to some toxins. Because a lot of times I'll see a husband and wife couple where she has no symptoms and he has a bunch of symptoms like brain fog, headaches, gut symptoms, and they all could be boiled down to root cause being mold or mycotoxin. Venoms and poisons are naturally occurring toxins. Heavy metals, such as mercury. The most common source of mercury in LA we see is sushi, because everybody loves sushi here. Arsenic, lead, and cadmium, which are in our air quality right now. Sunlight in excess, and tobacco and alcohol. Man-made toxins, industrial chemicals. The biggest one we've seen in the past 2 weeks is flame retardants. And housing materials, as asbestos is actually now in our air actively, and household cleaners, BPAs. And those are the things that we really focused on before this huge tragedy in LA. But now all these very sinister toxins are more of an issue in our environment. So common things is, plastics in our makeup, in our skincare, and foods and pans we normally cooking with is what we usually talk about when we talk about toxins. So what are the general effects of toxins? Usually people have sinus issues, headaches, congestions. They feel brain fog with some toxins, and the bisphenol A, which is in a lot of plastics, can impact your hormones. They can be endocrine disruptors, which mess how your hormones are processed. And for some people, cause fatigue. They can cause some of my male patients to develop breasts. They can cause some of my patients to actually be anxious or irritable. And the scariest things about toxins is they can trigger autoimmune reactions in your body and be the trigger of an autoimmune disease process, or they can also cause cancer. And this is, when I talk about functional medicine and regular medicine, this toxins right now is really coming to mainstream medicine because of this recent tragedy. And it's just really good medicine. It shouldn't be functional medicine. Internal medicine is what is good medicine, and how are we looking at your body, and what is your toxic burden, and what can we do to open up those detox pathways so you can reduce your inflammatory levels. So some brief history of toxins in California in the 1950s to 1980s. There was some chromium-6, which caused gastric tumors and cancers, respiratory and skin problems. We had the gas leak that many of you may be familiar with that caused headaches, sinus stuff. For us in functional medicine, when we were testing, those patients had a lot of hormonal imbalances. Riverside County had the acid pits that were all toxins that were also damaging your respiratory system, your cardiovascular system, and putting you at risk for cancers. So we do know, this is in a 2 weeks ago, and that there's so many chemicals that we put on our body or we inhale that most of them haven't even been tested. Are they safe for the human body? But our rapid exposure and daily exposure to these toxins are super high, and we know that some of these toxins are inflammatory and cause issues with our reproductive system, with hormonal imbalances. Lots of these toxins put us at risk to actually gain weight and be pre-diabetic. And if you're sensitive to these toxins genetically, you are more at risk to have issues such as obesity from toxic exposure, or diabetes or prediabetes. So these toxins are definitely something that have become part of our environment. As many of you know, this was our post 9/11. We did find that there were lots of people who died during 9/11, but we soon think that the deaths from the 9/11 diseases because of those toxic exposures will soon outnumber those who died on that fateful day. And right now we can see that the people who were first responders who had that immediate impact of toxic burden, the average lifespan is only 55 years, and they have a 30% higher rate of getting cancers than the rest of the population. And I don't know what it's going to be like for us with those all of us who are exposed to this LA fire in terms of the long-term consequences. So this is Mark Hyman. Some of you may know him. He's a big leader in functional medicine. And this is one of his quotes just talking about toxins. The simple truth is that we're living in a sea of toxins, and it's destroying our bodies and brains. But the good news about functional medicine is that you can have tools of knowing what your body's genetic predisposition to detox is, and knowing and measuring your levels of toxins so you can reduce that burden. It's not like a doomsday statement. So it's so much closer to home. When I initially prepared for this talk in December, it looked much different than this one. It was really talking about the toxic impact of processed foods, of stress, of undiagnosed gut health issues, and toxic burden, but more the common chemical toxins in the household and in our daily activities that we're used to seeing. But this is the aftermath of this recent tragedy that is still kind of unfolding, which is the fires that has just happened, and what is the toxic impact of that for each of us, even if we live further away from it. So for those, so I kind of cut up, but it's exposure to environmental toxins impact stroke risk and impact the gut-lung axis. And I like this article that showed up in the Cells journal, just talking about inhalation, like how do toxins impact us? And the ones to the left are all the heavy metals, air pollution, which right now we're just living in a toxic stew, but you can breathe them in or you can ingest them. And what they do are common things we see a lot and we measure a lot in functional medicine, but it can impact the the lung lining. It can, and these are particulate matter or persistent organic pollutants. They can cause your lungs to be more reactive. So that's what makes people who have asthma exacerbations, or people who don't have asthma develop asthma. And this all impacts your brain, and it impacts your blood-brain barrier. And this is your gut health. And if you are ingesting some of these toxins, it impacts your gut. And this is your gut lining. And we talk a lot in functional medicine about a leaky gut. And this is how toxins can damage these tight junctions and cause an issue with gut lining. So people can have more issues with bloating, abdominal pain, have dysbiosis, which is the wrong bacteria in their gut, which can lead to weight gain and fatigue and brain fog. So this is a recent New York Times article from January 27th. I don't know if many of you had the chance to see this, but at the height of the Los Angeles fires, we had 100 times lead levels than at average times in LA, and 40 times higher chlorine. And both of these toxins are pretty deadly on their own. They affect the brain. The lead affects the heart and affects the lungs, and is associated with a lot of inflammatory diseases. And this was actually for people who lived many miles, even miles from the flames. So it's in our air. If you don't detoxify, it's something that can impact you. And then this is an article from a long time ago, and we look at this a lot, especially in our male patients who've had a family history of heart disease, because lead has been associated with an increased level of the risk of having a heart attack. So it is something to be aware of and something to measure, because sometimes patients come in and they're like, I have a family history of heart disease. I'm super healthy. I'm exercising. I'm doing all these things, but I've already had one heart attack. How do I prevent the next? And that's where it's important to measure your toxins, say, oh, you have a high lead level from somewhere. And how do we naturally and safely get rid of that lead level so you don't have a risk of another heart attack? And this is another risk for toxins, which is actually dementia risk. This is my genes and also my mother's genetics. We have a E3, E4, which is a dementia risk. It actually puts us 3 times more likely than the rest of the population to actually have dementia or Alzheimer's. So it's important, again, to know your genetics and know this risk. And why this is important is I live in LA, and wildfire smoke exposure, there is a strong correlation between dementia risk and wildfire exposure. So the more toxins you inhale or ingest, your risk of dementia increases, especially for those like me who have this ApoE gene and something, in terms of being in Los Angeles, am I doing enough to detoxify? Am I measuring my toxin burdens? Am I reducing it? Because I am high risk for this endpoint disease that as a conventional doctor, we don't have any tools to prevent. So this is an article that was mentioned in the New York Times article talking about, I don't know how many of you remember, in 2018, we had the Paradise fires. And they were pretty devastating for those who remember it. And then what it showed is that people who were exposed to those fires and that particulate matter had a much higher rate of dying prematurely. So they estimated about 52,000 to 55,000 premature deaths, not from the fire, but because they were exposed to the toxins post the fire, living in that close to the Paradise area or living in that fire environment. And not only the economic damage, but really more people can die prematurely from having urban wildfire exposures. Okay, and this is the genetics of one of my patients. I actually asked if I could share it, and she was like, "Yeah, if it was going to help anybody, then for sure." So she's one of my patients who, once the fires kind of began, she was immediately not feeling well, and I was like, "You should really think about maybe going away for a few weeks till things settle down," because she has an MTHFR gene, so methylation. She doesn't methylate toxins and help you get rid of it from your liver to your feces and out of your body. She also has this COMT gene, which makes her susceptible to not get rid of toxins, and also makes her susceptible to be more anxious and more vulnerable to toxins, and she doesn't detoxify well. So these are the common genes that we see in our patients who don't detoxify. And this is, if you have genes like this, it's important to check your toxic burden. So remember, in functional medicine, we're not linear like in conventional medicine, where you have dementia and we give you a medication. or you have a urinary tract infection and they give you a medication, it's more triangular. So you have genetics that make you susceptible to things, and then you have exposures or mediators like this wildfire for all of us, or a ton of antibiotics. And then the tip of the triangle is triggers, things that were highly stressful in your life. So a lot of times patients are like, oh, I developed this autoimmune disease when I lost a job and I had this wildfire exposure. So it's usually the two things, the triggers and the mediators, that help you activate or switch on your genetics. So it's important to know your toxic burden, know your inflammation levels, so you can work on those and switch off your genetics. And that's kind of a new phenomenon for a lot of people, to realize that genetics can be turned on and off. And that's this whole concept of epigenetics. So these genes impact your phase 1 and phase 2 detox. This is the liver and how you process your nutrients and your toxins. And so my poor patient, she's still not come back to California because she's finally feeling better and she's in Canada. But she's going to come back soon. But this is kind of the toxic burdens that she will absorb, and it'll be harder for her to detoxify from. So what are some of the hidden signs of toxin overload? A common one is fatigue. So a lot of times, as a conventional doctor, we look for the common things. I know, are you anemic? Do you have depression? Do you have, what's kind of causing your fatigue? Do you have thyroid issues? But after you've ruled out a lot of those or seen some abnormality in those, a common root cause that's causing these hormonal issues that's leading to fatigue can be a toxic overload. Weight gain. So if you are eating the same and suddenly you're noticing a couple months or a couple weeks from now that you're just gaining weight without changing your diet or your exercise routine, think of maybe you have some toxic burden and unable to detoxify well. Mood swings, because toxins impact neurotransmitters, and they are associated with things like anxiety and depression. So that could be something that people could be experiencing. Brain fog. I think a lot of my patients now are just saying they're not feeling great in terms of word finding or recall. That being said, I deal with a lot of people who are perimenopausal and menopausal and already dealing with hormonal issues impacting memory, but toxins can be a hidden factor that can cause those issues. A few other hidden signs of toxic overload: autoimmune diseases. So I am expecting that a lot of my patients who had a negative ANA, which is this autoimmune marker that we finally been able to get negative, might turn positive over the next few months because of a higher toxic burden than previously. And we'll have to work on them to do some detox. Memory loss. I mean, I talked about dementia at the worst, but some signs or changes in memory. Hormonal imbalances. I could imagine that some of my patients might go into earlier menopause or earlier andropause, given the exposure to toxins. And then digestive issues, again, that gut lining that's leaky, or the change in the microbiome that could be a direct impact from these toxins. So how do you detox? So you guys have heard, I've tried to bring a lot of good evidence into why this regular medicine data show that toxins are bad for us. They can cause us to die earlier. They can be related to things such as fatigue, hormone imbalance, memory, and unwanted weight gain. And how do our bodies naturally detoxify? You can detoxify from sweating. So if you're super athletic and active, or you have some sort of sauna practice, you can detoxify that way. You can detoxify by sweating, peeing, and pooping. And if you make sure you're not constipated, that you're having regular bowel movements, that you're urinating and drinking enough water and hydrating so you can expel toxins that way. And another big part is breathing deeply. Unfortunately, now our LA quality isn't the best for breath work, but it's important to make sure that those pathways are all active. So who should detoxify? Honestly, I was going to say there's some subsets of people, but now since we're all exposed, I would say everybody should be doing some detox in 2025. But generally, it's people with digestive issues, people who have bloating, gas, discomfort after meals, or irregular bowel movements, or if you feel like from the holidays that you've been overloaded with poor diet choices, or have a diet high in processed foods, refined sugars, is a good time to do a bit of a detox. If you're experiencing low energy, your liver may just be overwhelmed with all that toxic burden or processed foods. It's good to give your liver a break. And if you're having any skin issues, so a lot of times like acne or inflammatory skin conditions, a detox is probably warranted. And those are mild signs of toxic overload. Sometimes people can have bad breath, a coated tongue, frequent headaches, difficulty concentrating. And at this time, anybody who has basic symptoms but feel like whatever the disease process or the flare is, feels like it's getting worse, I would consider a detox before looking to add a new medication or a new supplement. And then if you are thinking of transitioning to a more of a healthier lifestyle, you can start that with doing a detox. So who should not detox? So people who shouldn't detox are pregnant or breastfeeding women, because now you're pulling out these toxins from your organs and could be putting it into your baby, the milk for your baby, or into the placenta. So definitely, if you are pregnant or breastfeeding, I wouldn't consider a detox now. Just wait until the pregnancy is finished. And people with chronic medical conditions, if you have a lot of heart issues or liver issues, you should do detox, but partnered with an MD to know that you can do it safely. And you also want to make sure that your adrenals, which is your stress hormones, can handle a detox. Like if you've evacuated and are in a stress state, it may not be the right time for you to do a detox. So you have to support your adrenals, which is your stress hormones, so it could handle another stressor, such as a detox. And those taking certain medications, some of the supplements can interact with a detox, so you should be wary. And a lot of times people don't think of detox or supplements as a strong thing that can interact with medications, but a lot of the supplements that are nutraceutical grade are strong chemicals. So you need to make sure that your body can process that with your regular medication and there's no interaction. So what are some of the lifestyle choices that I recommend, or my team here recommends, for people who want to do a gentle detox? So one thing is increasing fiber, and that's to really get you to eliminate regularly. And what is fiber? A lot of times it's like, I'm eating a lot of salad, and salad like arugula or spinach has very little fiber. It only has 0.2 grams. All of us need around 30 grams of fiber. And if you are eating a whole bowl of spinach, you may only be getting 1 gram. So it's important to think about like beans and raspberries have a lot of fiber. Like a bowl of raspberries have 8 grams of fiber versus a bowl of blueberries have much lower quantities. So fiber is important, something you can do right away. Fluids to really hydrate and lubricate, at least 60 to 80 ounces of water a day, and functional foods to protect from oxidative stress. And those are things such as cilantro. So it's a good time for those of you who know how to make like a cilantro chutney. Try and eat that regularly in the next couple of weeks and months. Or parsley, you could make a good chimichurri. Things that natural foods you can incorporate to just help you gently detoxify. And then make sure that they're whole foods and they're organic. Another big thing is how you reframe your stress perception. Because if you this whole month was super stressful for myself and my patients and all of you. So just make sure you have perspective of how you're reacting, and so you can calm down your adrenals. Because if your adrenals are already ramped up, it's going to be difficult for you to detoxify. And then try using a sauna. This is something I've done a lot this month, is if you can gently go into a sauna and sweat, maybe start with 15 minutes and gradually increase to 45 minutes, but make sure you're sweating. And for those of you who don't sweat, generally it means genetically you're not a great detoxifier. So start getting those sweat channels opening and start slow, because sometimes if your adrenals are already taxed by all the stress of the past couple of weeks, you will actually feel worse from going into a sauna. So just, take these things slowly, start with food, and then potentially move to a sauna. But I can't stress how important it is to reframe your own stress perception so you can actually have a successful detox. So what are some of the supplement options that you can take? So big things that I say everybody should really be on, or some version on, is a vitamin D. And vitamin D, your goal is to be around at least 50 to 60. And as a conventional MD, your vitamin D range is between 30 and 100. And when you're 29, I would say it's normal. But as a functional MD, I would like your vitamin D close to 50 to 60. You really want it optimal, because vitamin D can support the liver in terms of getting rid of toxins. And you may not be going out as much, you may not be having that much sun exposure given the winter here, and you're not getting enough vitamin D. The second one is Mitocore. And all these supplements you can get online, you can get them on our website, you can get them anywhere. But Mitocore is a good supplement. It's like almost like a multivitamin, but it has a lot of good antioxidants in there and things that support natural detox capacity. And that usually says 4 pills on the bottle, but I just take 2. And I think that's a good thing to just take in place of your multivitamin for the next couple of months. And then this is a glutathione topical spray. So you spray it on your arm and you just rub it in. But those of us who are tired of swallowing so many pills, it's a great option. The one thing I warn you with it though, it does have a very sulfuric smell. So it smells like rotten eggs, but that smell goes away once you just rub it in. But it's just 2 sprays a day, and it's much more potent than oral NAC. And NAC is a precursor to glutathione, and the topical liposomal glutathione is actually as potent as one of our IVs. So it's a great option for people who can handle the smell. And then NAC is a precursor to glutathione. It's an amino acid that becomes glutathione. It's a much cheaper way of getting glutathione in your system. It helps support your liver to naturally detoxify. As I was explaining it to a doctor this morning, she was like, NAC, I don't want to take NAC. And I was like, wait, you're a regular MD. Remember, we use NAC to help people who come in with a Tylenol overdose. It helps them get rid of that excessive Tylenol. We use NAC to protect the kidneys from contrast. And she was like, oh yeah, that's a regular thing. She recognized, but it's a safe supplement and something that we should all consider taking at this time. So before getting to questions, I just wanted to mention 2 ways you can work with us. For all of those who know our practice, you know that we mainly work with patients now as a program membership type model. But given what's happening and trying to be more accessible, especially with functional medicine, to people who are not in our programs and memberships, we just came up with 2 different ways we could serve our communities. One is a 1-week detox challenge. Here's a QR code if you want to read more about it. But this is a Core Restore. It's one of my favorite detox 1-week things you can do. The whole practice is going on it next week. We're all going to be doing the Core Restore together. There's a booklet in there where it will tell you to avoid all the inflammatory foods like gluten and dairy, but it's just 1 week. And there's some good supplements. You could probably pause on most of your supplements, not your medication, and take the supplements as recommended here for 1 week. But those of you who feel a side effect with the Core Restore, you should probably do it. It's only a 7-day challenge, but I would do it over 2 weeks. But it does really tell us a lot of times how people can handle a detox. If you can breeze through this, you may not have too much toxic burden. If you're struggling through it, you may have a lot of toxic burden, and worth checking what's going on with your body. The nice thing about Core Restore is it's just 7 days, and a lot of people do feel better with it. But some people can have side effects. If you do click on that QR code, you can join our Facebook group where we are trying to support people who are going through it with us, especially if you're having side effects or have questions or want to keep motivated. So we're doing that next Monday. I welcome anybody who wants to join. Please join. It is a lot of supplements. So I just warn those of us, it's a protein powder and supplements, just do it for a week. But again, you could pause most of your supplements and do that instead, just as a 1-week cleanse from whatever's happened this month, or even a cleanse from the holiday season. The second thing I wanted to tell you about is we don't see at Sayana Medical one-off visits anymore. It's really programs and memberships, but this is really for people who maybe have worked with us before or are just curious, do they have toxins in their system right now? Because as a conventional doctor, you could maybe go to your primary care and say, can you check my toxins? They just won't know what to do with that. They could do it at Quest, like they could do your lead levels at Quest or your cadmium levels, but those levels are always going to be low. You do need to do like a functional test to see if those levels are even slightly high, because we want to measure this at much lower levels than what a commercial lab will find acceptable. So really in terms of measuring lead and cadmium, because that's really what's in the air right now, as well as mercury, to see if that's even an issue. So you could do a toxin lab consult. You can also do a DNA life with us to see if your genetics are even susceptible to toxins. But I would rather just you check the toxic burden, because the genetics don't really change your management. It's really, do you have toxins now, and do you need to bring it down? And with a toxin lab plus consult, we are checking your adrenals, because if your adrenals are flatlined because of stress or chronic inflammation, you won't be able to tolerate the Core Restore or detox. So we would give you some adrenal support, and we are checking your nutrients, because it's important with doing any kind of detox that you have enough nutrients to support your detox efforts, like B vitamins, antioxidants, and get a sense of what those are. So with the toxin lab plus consult, you get the NutriVal, which is a common Genova test measuring your nutrients and measuring your toxins, an adrenal test, and you also get the Core Restore kit that comes with it. So this is something, if you want to do, you are welcome to. You have 3 months once to the time of getting the toxin lab plus consult to do the test. And the big thing I think with functional medicine is important is don't assume you don't have toxins, don't assume you do. Check it. I mean, if you really think you have no symptoms and nothing, just do the core restore. Join us next week. Or another way of really knowing what's going on with your individual body is to check your levels around adrenals, nutrients, and toxic burden. And it's important to do that as foundation, obviously, to prevent the chronic diseases I talked about, but really improve your quality of life in terms of fatigue and hormone imbalance, and also just for prevention. So what comes with the toxin insight is you get all the blood work, your adrenals, your toxic levels. You will meet for 90 minutes with my PA or my nurse practitioner to go through it. And you'll have 1 week off and access to our portal where you can answer any questions, where they can answer any questions for you. And also in that 1 week of portal access, you can always directly message me if you have questions on what the lab means or what you should be doing. But it's just our way of making sure our patients we've had before or patients who want to just find out quickly what their toxic burden is, have access to that. So that it would be $1,900. That's what we charge for it generally. But because of the a special, given everything is going on in the new year, we're charging $9.99. So again, it includes the labs and the visit and access to Spruce Juice and the Core Restore kit, because that should be hopefully the only supplements you do need, and you would get adrenal supplements or other things you need on your own. And if you can't do this and it's too overwhelming, just do the Core Restore Detox. And if all that is too overwhelming, just make sure that in your home, a big thing is you have an air filter. So I have a lot of patients who do have air filters and they never switch it on because it's too loud or it keeps their partner up. So I would really invest in a good HEPA filter and make sure you switch it on. We have the Austin air filter, but you can get the Ion, you can get the Rabbit, you can get the Winx. The cheaper the filter, the more often you have to change the actual filter. I think the Winx, you have to change it every 3 months versus the Austin, you change it every 5 years, but it is a little loud. It's important to make sure if you get nothing from this talk, make sure you have an air filter, make sure you're hydrating, make sure you're getting enough phytochemicals, and make sure that you are sweating some version or the other. So if you're going to the lab consult, you can do it with Serena or Annie. These are our functional certified providers at our practice, and they are, and what they would do is you would do the labs, we would create a report of findings for you. I would discuss with them your plan, and then they will spend 2 hours going through it with you. And afterwards, you would have a 7-day access with them on the portal. If you have any questions, we want to make sure that you understood the test or the recommendations really well. Great. So if you want to do the lab consult, and I'm thinking about it, here's a QR code for this. This is not on our website. It's only for the people who are attending this webinar. So if you do, so a lot of times patients are like, well, you gave me all this information, but I can only see you in a program or membership and I can't make that investment. What else can I do? So we came up with this toxin lab consult as something we could offer that is not that much of an investment than our usual programs and members. If you're curious and if you want to know what your toxic burden is, what's the state of your adrenal hormones, and what your nutrient levels are. So this is a QR code. If you somehow haven't got it, you can always email us and we can send it to you. So I wanted to leave you with, before I just go to questions, is, again, thank you so much for spending some time with me on Monday evening. This is our Sayana Medical Roadmap, and I think of it as an iceberg in the ocean. The tip of the iceberg is more our regular conventional labs, which is your annual physical labs and maybe if you're lucky, thyroid labs. Maybe if you're super lucky, somebody will check hormones. But it's important to go below the level of the water, because as you age, the level of the water is going to recede and these things are going to become more of an issue. So things like genetics and lifestyle, inflammation markers, gut health, hormones, toxic burden, infections. So if you do the toxin lab consult with us, you would get the toxin heavy metal test, plus it has plastics and gasoline, and it has some gut markers on it because it's a Nutravel, some nutrient levels, and we'll definitely check your hormones in terms of adrenals. So that's what the toxin test includes. And I'm going to take questions for a couple of minutes. So if anybody has questions, feel free to ask them. And if you need any of these these supplements. Again, we have them here, or you can get it online. And for one person, I am going to raffle something I think all of us should be on, which is NAC. So if you, usually it's safe for most people to take. It does help the liver, and you could just take one pill a day. So I want to have Alyssa tell me among the attendees today, who is the person we mail it to, and if you could just, we'll follow up with you and get your address so we can mail it to you. And the last thing is we wanted to give you our PDF on things you can do at home, just practical lifestyle or supplement things you can take. So you can share it with your friends, or try and do something where you can work on that. So Alyssa, and before I get to questions, let me see who is winning that detox kit. Great. So she's going to put it in our group chat, the PDF, so everybody can download the kit, whoever needs it. The detox PDF on how to detoxify. And then the lucky winner is Sana. So Sana, we will get your information and you can take NAC. It's one a day. It's nothing to be fearful of. It's a safe supplement. It will help your liver. If you're already taking something with NAC, this one has 500 milligrams a day. You could take up to 1,000 milligrams pretty safely. So we will get that information from you. And I will... and right there where Alyssa put it at 6:39 is the detox post-fire handout. So if you want, you can grab that there. And let me just make sure I answered any of the questions. Best way of decreasing inflammation. I hope I've answered that, Sana, to your satisfaction. Really look at the gut, look at the hormones, make sure you're not breathing in toxic air and eating toxic food. COVID, yes, COVID is in that triangle, can worsen your detoxifying ability and can cause inflammation, can cause things like autoantibodies to kind of show up again. So I would say you could do the core restore for sure, or you could check and see where some of those levels are. Colon cleanse, detox twice a year for more than 20 years. If you're doing colon cleanse detox, that's a short amount of time, it should be okay in terms of helping your supplements get absorbed. As long as it's something that's not inflammatory, I would say it should be helpful in terms of what it is. What's in the core restore is all food-based ingredients, so there's nothing that's concerning in that one. Wearing a mask. I asked my son to wear a mask today. He is 10 and he said no. I think there's a lot of this is pandemic 2.0 for a lot of us living in LA. And my son was on Zoom for 2 weeks because the electrical panel was impacted by his home. So I just think going back to masks is hard to enforce, but I personally would wear a mask at least for the next month if you can. But I know that's difficult because I'm telling a lot of people to go outside and work out and be active. But at least if you're not going to wear a mask, at least check your toxins or do something to help you detoxify. Awesome. Any other questions? You guys know where to get a hold of us. How often do you recommend a sauna? I sauna 3 times a week, but I would recommend starting slowly, at least 15 minutes once a week. Infrared sauna in Burbank is a good place a lot of people like because you can go there for half an hour increments and it's affordable. I think it's less than $30. And ideally making sure that you are in the sauna and you're hydrated and have eaten. I can't tell you how many patients have fainted in the saunas when I recommend them. So please make sure you eat and hydrate. Mitocore, if you feel ill and you feel like you have symptoms post-detox, post-fire, I would take 4 Mitocore, 2 in the morning, 2 in the evening. And if you feel that you're moderately okay, just take 2. And Alyssa will repost the QR code here. Vitamin D. So vitamin D, I would really look at your level. Again, as a conventional doctor, less than 30 is considered okay, but I would say between 50 and 70 is what your goal should be. So you should have a level. I say a safe dose to take is at least 5,000 a day. I've been honestly taking 10,000 just to get my vitamin D levels up, but it's an important thing to keep up with and then check levels. And that's what's important, is checking those things is important. Anything else for dealing with COVID? Vitamin D, make sure you're taking at least 5 to 10,000 of vitamin D, NAC, and then really try and say, what has COVID done to your system? Because if it is, COVID is an inflammatory part of a mediator in that triangle? Has it pushed your inflammation pathways? Has it impacted your ability to detoxify? What has COVID done to you? So it's important to kind of get a sense of like where are your adrenals and what's happening with you. And if breathing issues, I would say for COVID, a great supplement to take is quercetin with a Q, and that is from kale and red onion. It really helps the bronchioles in terms of helping open up the pathways. And another big thing is NAC. So glutathione and quercetin should help in terms of regulating some of the breathing issues, and then go deeper and see, do you have any issues in terms of autoimmune things that are re-triggered? Yes, so the red blotches of skin, for people who kind of experience that after every sauna session, you are probably maybe detoxifying a bit too fast. So I would go slower. So just kind of remember, the skin is a reflection of your gut lining. And so when you are in a sauna, we hypothesize that these toxins are coming out and damaging your gut lining, because of the toxic burden much quicker. So just go slower. One thing you can do before a sauna is I use the glutathione spray, or you could take some NAC and just see if that helps your body mitigate those side effects. Perfect. And then let's say you want to put the QR code in here. Actually, what we'll do is we'll make sure we send it to all the participants after. We'll send the recording, and we'll also send you the QR codes for both of those things so you can at least research and look at them. Any last questions before we end? Okay. Thank you, guys. Have a good evening, and stay safe and maybe mask. Take care. How long for infrared sauna for beginners? Beginners, I would say 10 minutes. 10 minutes for you, Jan. Like maybe just go in there for 5 minutes, keep the temperature low. I go in at 140 degrees, but I would say maybe start at like 100, 105. Go slow, because a lot of people don't feel well if they have a lot of toxins. Go slow and make it your friend. It doesn't have to be a race. How can you support adrenals before you detox? The question is, where's your cortisol? Is it too high or is it too low? Symptoms, if it's too high is you can't sleep through the night. You get up and you see the clock and it's 3 to 5 in the morning. That means your cortisol may be too high. So things you can take is cortisol manager, which you can find on our website, so you can read and find out more about it. Or if you find that you're kind of dragging through the day and you're exhausted by like 10 a.m., that means your cortisol is too low. Then you could take Adreset, which is also on a site, but it's under cortisol management, and that can help push up your adrenals. So if you're struggling and don't have the capacity to check your adrenals, then I would look at those two symptoms and kind of see where you could be, and try a supplement for that before trying a detox. If you do the core restore though, and you feel like you're kind of sluggish already, I would do that 7-day kit, but over 2 to 3 weeks. Just go slow, and that should really help in terms of mitigating side effects. Awesome. Take care, ladies. So I don't know if there's any guys on here. If there are guys, take care, guys, as well. Take care, and yeah, stay safe.